Welcome to the deep dive. Today, we're tackling something that sounds simple, but is actually quite complex. How doctors figure out what's wrong when you have a vision problem.
hmm
Because let's face it, when you say your vision's blurry or your eye hurts, it's rarely just one thing, is it?
Almost never. It's definitely more like putting together a puzzle piece by piece.
Exactly. So our deep dive today is into what's called multi-perspective clinical thinking in ophthalmology. Sounds a bit technical, maybe?
A little, maybe.
But the idea is actually really practical. We're looking at a structured way, like a six-step approach that helps eye doctors sharpen their diagnostic skills and, well, really get what's going on.
Right. It goes beyond just naming a condition.
We'll explore how things you might not even think about, like your age, your sex, other health issues you have, can totally change how eye symptoms show up and what they mean.
Yeah, the context is crucial.
Think of this as getting a clearer view of the whole picture, maybe unlocking some aha moments about how clinicians think.
That's a good way to put it.
Okay, so let's start with the classic. Patient comes in, says, I've got a red eye. Seems straightforward. How does a clinician start breaking that down? Where do they begin?
Well, the absolute first step is thinking anatomically. Yeah. Structure. We call it localization.
Localization, okay.
So for that red eye, we're immediately asking, where is the redness? Is it superficial, like on the conjunctiva, that clear layer over the white part?
Suggesting maybe pink eye or allergies.
Exactly. Or is it deeper, involving the sclera, the white part itself? That could be scleritis, which is potentially much more serious. We're basically mapping the symptom to a specific part of the eye first.
Got it. Pinpointing the address of the problem. Now, here's where it gets interesting, I think. How do things like age or sex start influencing this initial mapping, even for something common like a red eye?
Oh, they're huge filters. Absolutely huge. Take that red eye example again. In a kid,
Yeah.
you might think, oh, okay, maybe they poked their eye, or it's just basic conjunctivitis. Pretty common stuff. But the same red eye symptom in, say, a middle-aged woman, our thinking might pivot towards something like thyroid eye disease.
Which affects the structures around the eye, too.
Exactly. Bulging, eyelid retraction, that sort of thing. And then you take an elderly patient with a red eye,
Okay.
especially if they mention other things, maybe feeling unwell.
Yeah.
Our minds jump to conditions like giant cell arteritis, GCA.
That sounds serious.
It is. It's an inflammation of blood vessels, a real emergency. So you see, the patient's profile age, sex, immediately shifts the probabilities. It's like accessing different databases in your head.
Wow. Yeah, that really highlights how just knowing those basic details completely changes the starting point.
Yeah.
Okay, so we've sort of figured out the where, what's next, understanding the how, the mechanism behind it.
Precisely. Now we move to pathophysiology. What's the underlying biological process causing the structural issue?
Okay.
It's ischemia, a lack of blood flow, like a central retinal artery occlusion, basically an eye stroke. Or maybe NAION, non-arteritic ischemic optic neuropathy, where the optic nerve isn't getting enough blood.
Or it could be inflammation.
Definitely. Like uveitis inflammation inside the eye, or optic neuritis, inflammation of the optic nerve itself.
Yes.
Well, there's degeneration, think AMD, age-related macular degeneration, or glaucoma, or even tumors like a choroidal melanoma, and sometimes infiltrative diseases like sarcoidosis, where inflammatory cells build up.
So many possibilities. Can you give us a scenario where knowing the context really changes how you think about the mechanism? Let's stick with our red eye patient, the elderly one, if they also mention feeling tired and maybe some jaw pain.
Ah, okay, that's a game changer. That combination, elderly patient, red eye, fatigue, jaw pain, it strongly points towards giant cell arteritis.
And the mechanism there is?
It's systemic vasculitis,
Yeah.
inflammation of arteries throughout the body, not just in the eye. It's a systemic process causing the local eye sign. Very different from, say,
A younger person with uveitis.
exactly. In a younger woman with uveitis, the mechanism is more likely autoimmune, maybe linked to something like lupus or sarcoidosis. Or in a child, a structural issue might point to a mechanism like abnormal vessel development in Coats disease, or even a tumor like retinoblastoma.
So understanding the why, the mechanism, is critical for treatment.
Absolutely crucial.
Yeah.
And often, it dictates urgency. GCA needs immediate treatment.
Okay, so we have structure, where, and mechanism how, but what the patient really feels is the impact on their sight, right? The what's changed. How does that functionality perspective fit in?
Yes, this is where we connect the anatomy and the pathology to the actual functional consequences. What can the patient no longer do as well?
Like reading the eye chart.
That's visual acuity loss, yeah. Seen in refractive errors or macular disease.
Yeah.
But it's more than that. Are there field defects, blind spots? That suggests glaucoma or maybe nerve compression.
Okay.
Loss of contrast sensitivity makes it hard to see in dim light or distinguish similar colors, common in cataracts or AMD.
Makes sense.
Changes in color vision often points to optic nerve problems or binocular disruption, the eyes not working together. Think strabismus or nerve palsies.
So for our GCA patient, the functional impact would be?
Severe. Potentially rapid, profound, and often permanent vision loss if not treated quickly. That's the functional consequence we're trying to prevent.
That really drives home the stakes. How does age modify this functional picture?
Age is a big factor here, too. In kids, the functional impact might be hard to spot. They might not complain, or they adapt, or they just can't articulate it well.
Right, they might not even know it's normal.
Exactly. But in an older adult, even a relatively mild functional loss, like difficulty with night vision or glare, can seriously impact their independence. Driving, reading, just navigating their home safely.
So it's not just about the numbers on the chart, it's about real-life impact.
Absolutely. It connects directly to their quality of life.
Okay, structure, mechanism, function. Now let's zero in on the clinical picture, the symptoms and signs. This feels like where the detective work really kicks in.
It really does.
Yeah.
This is about gathering all the clues. We take the chief complaint, our red eye, and we put it together with the history of the illness.
Like, how did it start? When?
Precisely. What makes it better or worse? Then we add our examination findings. What do we actually see? And we look at the chronology. How has this unfolded over time?
And you're asking specific questions.
Critical questions. Is it one eye or both? Unilateral or bilateral? Did it come on suddenly, acutely, or gradually, chronically?
Nice.
Is it getting progressively worse? These details are vital clues.
But it's rarely just about the eye in isolation, is it? How do you factor in the bigger health picture, those systemic things?
You absolutely have to. You have to consider the whole patient. Do they have diabetes, high blood pressure, an autoimmune condition? These can totally change the picture.
So for that suspected GCA patient?
We'd be asking very specific questions beyond the eye. Any new headaches, scalp tenderness when you brush your hair, pain in your jaw when you chew.
Wow.
And medication history is crucial. Are they on drugs known to affect the eyes, like hydroxychloroquine or steroids? You're looking for clues everywhere, trying to piece together the whole story.
It really is like being a detective. So we've gathered all this clinical data, but what about the person experiencing it? Why is understanding the patient's perception so important?
This is huge, because vision loss, or any eye problem really, isn't just a clinical finding, it's an experience. We need to understand, what does this mean for them? Can they still read their mail? Can they drive to the grocery store? Can they do their job?
Practical impacts?
Yes. And the emotional ones too. Are they scared, worried about losing independence, maybe even embarrassed or ashamed? For the GCA patient, the fear is immense, potentially going blind quickly.
And how are they coping?
Are they using magnifiers, getting help from family, or maybe they're doing nothing, just trying to ignore it, which tells us something too.
How do things like, say, health literacy or gender or just where they are in life affect this experience?
They play a massive role. Someone with lower health literacy might not grasp why a detached retina needs surgery right away. They might not understand the urgency.
Or why a tumor that isn't causing pain is still dangerous.
Exactly. And life stage matters. Vision loss for someone working age, that brings financial stress, career worries. For an older adult, it might tap into deep fears about becoming dependent, maybe needing to leave their home.
It really underscores the human side of all this.
It's essential. You have to connect with that experience to provide truly patient-centered care.
Okay, so we've layered on the patient's experience. The final perspective brings it all together, right? Looking outwards. Does this point to something systemic that needs teamwork?
Absolutely. This is the interdisciplinary thinking perspective. We ask, is this eye problem a sign of something bigger happening in the body?
Which often it is, it sounds like.
Very often.
Yeah.
The eye can be a window to systemic health. For a GCA patient, that red eye plus headache and jaw pain is a clear signal. We need a rheumatologist involved immediately.
So knowing when to call in other specialists is key.
Crucial. We need neurologists for things like optic neuritis or unexplained double vision. Rheumatologists for conditions like scleritis or vasculitis. Oncologists if we suspect a tumor.
Endocrinologists for diabetes or thyroid eye disease.
Infectious disease specialists if we suspect infections like CMV retinitis or syphilis affecting the eye. The list goes on.
So that simple red eye we started with.
Right. In a young adult, maybe it is just viral conjunctivitis. Annoying, but usually self-limiting.
Huh.
But that same red eye in our 75-year-old with fatigue and jaw pain, seen through all these perspectives, it becomes a potential systemic emergency giant cell arteritis. Requires immediate action, often involving steroids, and close collaboration to save their sight and protect their overall health.
It just shows how connected everything is.
The eye is intricately linked to the rest of the body. You can't truly understand what's happening in the eye without considering the whole system. That holistic view is vital.
Wow. That was quite a journey through those 6 perspectives. It really paints a complete picture. We went from structure
The where,
to mechanism,
the how,
functionality,
what's changed for the patient's vision,
clinical presentation,
to symptoms and signs,
the patient's own experience,
how it affects them.
and finally that systemic interdisciplinary view.
Right. And the fascinating thing is, this isn't just, a theoretical model, this multi-perspective thinking. It really is the bedrock of clinical excellence in ophthalmology.
It's how you go beyond just diagnosing.
Exactly. When you analyze symptoms through all these layers, you don't just treat a disease label. You understand the patient sitting in front of you.
Mm.
And that leads to much better, more personalized care.
It really does. And maybe a final thought for you listening. This way of thinking, this layering of perspectives to see the whole picture.
Mm.
It's not just for doctors diagnosing eye conditions.
Mm-hmm. Good point.
Think about it. How could you use a similar approach looking at structure, mechanism, function, presentation, experience, and the wider system to understand any complex problem or situation you face, whether it's at work, in your community, or even just understanding a relationship better? Could looking at it from all these angles help you find deeper insights and maybe, just maybe, better solutions?